We cannot get to the other side and look back as a country and think we should have done more earlier. Hence we've supported, as Anthony said, every single measure that the government has put in place, including some that have been controversial at the time. We've supported every single measure, but we've also made constructive suggestions that more should be done. And in that vein, yesterday the government announced a small expansion in the telehealth rebate, which I very much welcome. But I say that it needs to go much further. We don't want Australians who can avoid going to the doctor having to go to the doctor because they can't access telehealth, telephone, Skype, to talk to their doctor. Every single Australian, whether they're dealing with mental health or physical health, needs to have access to Medicare telehealth during this crisis at least. And, importantly, this is based on feedback right across the country. I've been talking, as you'd imagine, to many, many doctors. The doctors need to be able to provide that service from home. Some will be self-isolating. Others will want to avoid the surgery if they can in the coming weeks. But they can still provide a service to people, telehealth, in their own home. That's not currently covered. This needs to be expanded. I say to the government, please expand the telehealth rebate further than they already have. Secondly, in relation to the respiratory clinics, we've welcomed the government's announcement. They've been talking about it for some time that there'll be respiratory clinics opened. They're still not scheduled, most of them, to open until May, the second half of May. This is too slow. We need the fever clinics up and running. Even if they're not actively being used straight away, we need them up and running if and when they're necessary. This is a national emergency and it needs all the resources of the country applied to it. Hence, we're suggesting that the ADF, our military capacity, be deployed where appropriate to help the fever clinics open as soon as possible, whether it be the engineering corps, whether it be the medicos, the medics in the Army, in the Army Reserve and across the ADF. Please consider using the ADF as a matter of urgency to assist the respiratory clinics to be open as soon as possible. I just want to deal with one other matter before Anthony and I take questions. And the Prime Minister said this morning, and Greg Hunt said it, and we agree. There's a lot of misinformation, particularly online. I don't know what motivates somebody to make things up online during a crisis. I really don't understand what leads people to do this. But I say to all Australians, be careful what you believe online during this crisis. Whether it says Greg Hunt or Scott Morrison did something, whether it says I said something, there's one out there about us, it's a fake, it's a fraud. Just don't believe it. Go to the credible sources. There's health.gov.au, but there's the ABC, who's been a remarkable source of factual information, particularly Dr Norman Swan and their CoronaCast podcast, which I recommend to all Australians. There's lots of credible information out there. Let's stick to that. If you see something online, it's very disturbing to people when they read the alarmist material online. We don't need that. Please don't do it, and please be careful when you're sharing or forwarding material online to make sure it's a credible source.